I would like to know from you, since this particular summit, it has brought all the entities of the healthcare fraternity. We have doctors, we have researchers, we have professors, we have teachers. And there's a collective, cumulative research work of more than 100 years. So what are your expectations from this particular summit, sir? Kindly.
It's actually a real good idea to organize and participate in this kind of a summit, which is Indian at the same time. It's a global context. And healthcare system in India is quite different. At the same time, both in the context as well as it has to take care of the 1.25 billion people. So the scale is different, and given our economic situation and our rural-urban situations, we need to have innovative ways of healthcare system in this country. Specifically, with a lot more people living in rural areas and whose purchasing power is low, whose income available for spending on healthcare is very low, and a substantial percentage of people in India suffer from malnutrition. We require a country-centric healthcare system that addresses these issues. And also, we cannot apply some of the healthcare strategies and protocols and measures that are prevalent in Western countries and developed nations because of the reasons which I cited just now. But also, genetic diversity in Indian populations is quite high. So we require a diagnostics, country-centric, Indian population-centric diagnostics, innovative ways of diagnostics and therapies, and also a thorough analysis of the molecules, their interaction with specific genes, gene expressions in these individuals. And this goes a long way. Right now it's expensive. With the next generation sequencing and other human diagnostic technologies are rapidly advancing all over the world, and in India too, we have a real situation cut out for us to innovate cheaper, that is affordable, but high quality and knowledge-based diagnostic system in the first place. And then design molecules that will serve as a therapeutics for Indian populations and diversity, although this does not preclude the global way of looking at it. We still look at the global systems. Specifically, India is well known for generics and biosimilars. But that scenario has to change. India will have to get into discovery of the new molecules, new therapeutics, and also in an affordable manner, in a safe way. We have developed these systems and go ahead. In this case, we don't have a good number, not even a reasonable number of School of Health and Public Health and Hygiene in this country. We have hospitals, we have medical institutions, but we have very few. Given our size of 1.2 billion people, we have very, very few national or state schools of public health and hygiene. And healthcare delivery depends upon professional as well as qualified scientists, as well as the people who can take this system to the people. So the delivery is going to be a tough job, and trained personnel are essential. The training is essential now. So we have to learn some lessons from the global systems which have perfected in these healthcare systems globally and locally. So in that context, this conference, this summit will have a great future. And this is a good opportunity for Indians to know what's happening outside the globe, globally, and also to see how we can adopt those technologies and those protocols here in this country.